Greetings. My name is Caldwell Esselstyn Jr., and I direct the Cardiovascular Disease Prevention and Reversal Program at the Cleveland Clinic Wellness Institute. I'm happy to be with you today to discuss part 4 of our series on the nutritional treatment of coronary artery disease. And I just want to raise the question, is chronic illness multiple diseases, or is it really one disease? In other words, is it multiple manifestations of a common process of inflammation? For instance, what's the good of having a strong heart if your brain is going to give up on you? We know that by age 85, 50% of Swedes and 50% of Americans are going to have dementia. But we really got some exciting insight to this from Megan Leary and her team from the West Coast when they reported at the stroke meetings in Miami in 2001. They reported looking at over 5,500 MRIs of the brains of Americans. And what they begin seeing at age 50 on these MRIs are these tiny little white spots. Now we know that these tiny little white spots are little strokes. But at age 50, big brain, small stroke, not a problem. However, now you're 65. You've had 15 more years of the good old American diet. And you find yourself perhaps more often than before saying, "Sweetheart, where'd I leave the car keys?" Well, you get over that, not a problem. Now you have 10 more years of the good old American diet. You're now 75. And you look at her and you say, "Sweetheart, where'd I leave the car?" Well, she's understanding. You kind of get that all worked out. Now you find yourself at 85. You've had 10 more years of the good old American diet. And you look at her and you say, "Are you my sweetheart?" I can't reverse that. You don't suddenly become demented on your 85th birthday. You work hard in all those preceding decades to establish the foundation for heart disease. Now, the one you're looking at now as an MRI is normal. On this one, I've counted over 90 of these little lesions. You can imagine how challenging it will be for any neuron to carry a message through that kind of scar. Now, this, on the other hand, if you will look at that aorta, in the aorta, the artist has drawn some disease, because just like inside the coronary arteries, there's going to be disease in the aorta. And it was a study by Pierre Aramenko from France, who did an interesting study where he had Frenchmen swallow an ultrasound probe in their esophagus, and the esophagus has such anatomical proximity to the ascending aorta that he was able to get pictures of the aorta and describe whether there was 1 millimeter of atherosclerotic debris growing on the inside wall of the aorta, or whether there was 1 to 3.9 millimeters of debris, or whether it was over 3.9 millimeters of debris. Then they followed these Frenchmen for over 3 years, and which group had the highest rate of stroke? Yes, the ones who had the greatest amount of debris, because as the blood goes roaring up that ascending aorta, this material, some of which is really very loosely attached, breaks off, and the path of least resistance is right at the top of the aorta where these arteries branch up into the brain. And that's why the group with the greatest amount of debris had the greatest amount of stroke. Now, where you really sort of see this in spades is at the time of somebody having a coronary artery bypass operation. The surgeon will use a Satinsky clamp and pinch up a little cuff of the ascending aorta so that he or she can sew in a bypass graft. But if at the time the surgeon is clamping that ascending aorta, the nurse is now monitoring the middle cerebral artery in the brain. He says clamping, and she hears whoosh, and if it's 4 bypasses, they hear whoosh 4 times. And sadly, should the patient die and come to autopsy, as was done by Dr. Guy McCahon in Johns Hopkins, what you'll see in the brain is this debris, which may help to explain why it is that roughly 50% of those who have bypass operation by careful neurocognitive study will lose over 5 years 22% of their cognition. Now this is interesting because on the left we have a normal brain. The brain goes right out to the skull. On the right we have a brain with atrophy. There's quite a bit of space between the skull and the outer limit of the brain. But the good news is that as you become more senior, you don't always have to have all parts of your brain atrophy. There are parts of your brain that you can actually make grow. What parts are they? The hippocampus, which is responsible for memory. The frontal lobe, that is responsible for executive thinking. How do you make it grow? Exercise. What kind of exercise? Well, it should be fairly brisk. And if you're going to walk, maybe it has to be 3 or 4 times a week where you're walking briskly enough almost to break a sweat. Or obviously you can do this with swimming and cycling and so forth as well. But the good news is that with exercise, you can hold on to your brain and perhaps even enlarge some very vital parts. Now, we're going to have to look at the leg. We talked about the brain, we've talked about the heart. This is kind of fascinating. This was a gentleman who came to my office in 1986 when he was crossing the Skyway. He would notice that he would get this pain in his right calf because he had a partially blocked artery in his thigh. And on the left, you can see his pulse volume that we measured at that time. Now, over the next 10 months, I was so focused on his heart, I totally forgot about his leg. At the end of 10 months, he said to me, "Dr. Esselstyn, do you recall when I first started coming to see you and I was crossing the Skyway to your office, I had to stop 5 times. He said, this last month, it got to be 4 times, 3, 2, 1. He said, I'm not stopping anymore. I no longer have leg pain. Don, back you go to the vascular lab. And now you can see on the right, indeed, the pulse volume has doubled from what it was originally. Now this was kind of a eureka moment for us because this was with that original study. And this was the first time that we now had absolute rock-solid scientific proof of concept that with food and food alone, that we could arrest and reverse cardiovascular disease. Because now the pulse volume was double what it was originally. And the reason that this was such an exciting moment for us was that there were no statins. In 1986, there were no statin drugs available. So I've now given you, in our earlier segment or a part of the series, I talked about Dr. Crow, who refused to take statins, and then this gentleman, where there were no statins, and they had absolutely profound, excellent reversal of their disease. So if you encounter patients who are unable to or refuse to take statin drugs, if they will comply with this type of a nutritional behavior, they're going to get an excellent result as well. Now this is another patient where we're looking at the legs. This is a 78-year-old retired high school chemistry teacher, and in his retirement, he and his wife love to enter these square dancing contests. However, he noticed that when they were doing the fast square dances, he was getting bilateral calf pain, both legs. So he went to see a team of vascular surgeons, and this was the image that they got showing this severe disease. But he was not very enamored of this rather large procedure that they had proposed for him. And so he counseled with us, found us over the internet, and he said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of this calf pain? So I suggested it would probably take about 10 or 11 months. And 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, we've talked about the brain, we've talked about the heart, we've talked about the leg. Now, I don't know how many of you in the audience are in the habit of watching athletic contests or mysteries, but certainly in Cleveland, Ohio, just prior to having the commercial come on, you will hear the mellifluous tones of the advertiser say something like this: "When the moment is right, will you be ready?" Now, we all know that the penile artery is really quite tiny compared to the coronary artery, so not infrequently, before somebody ever comes down with heart disease, they may find that they are no longer able to raise the flag. But all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I will get a phone call. "Dr. Esselstyn, this is Mr. So-and-so." Sure enough. Said, "You know, I just thought I ought to give you a call because recently something has come up again. And I'm wondering if I don't owe you another check." Enough said. Now, the next thing that I think is of interest is that 400-meter walk study of Anna Newman and Tamara Harris. This is interesting because they took patients who were over the age of 70, and they had them walk 10 meters out, 10 meters back, that's 20, and they actually had they do that enough until they covered 400 meters, and they timed them. Then it was interesting, they followed them for 6 years, and then they compared, and they divided these into quartiles with the fastest, next fastest, next fastest, and slowest. And when they compared after 6 years, the fastest with the slowest had the greatest onset of new partial disability, the greatest onset of new total disability, and the greatest difference in mortality. Now, what in the world is going on here? You may recall earlier in this segment when I discussed the small strokes that were occurring. Now, all of us have in our head, over the top of our brain, we have this motor strip. And if for some reason some of these small multiple strokes accumulate in that motor strip, then this is going to affect our ability to walk with alacrity and dispatch. So for these patients, just as their extremities were experiencing withering, shrinking, and atrophying, their brain was experiencing withering, shrinking, and atrophying. So another reason to really try to eat plant-based and prevent these small strokes from occurring. Now, this is a slide actually I borrowed from a friend of mine, Dave Schumann, and this is a diabetic. And about halfway across the slide at the top, you will see it says diet change. That means that he finally convinces this gentleman to go to plant-based nutrition, and immediately his blood sugars begin to fall into the more acceptable range. And I got a call from Dave the other day and said, "Look, this man no longer has diabetes." And here's another of his patients. And this woman, her urinary calcium should be no higher than right in the middle of that blue band. She is thriving on meat and dairy products, and you can see that her urinary calcium is way outside that blue band on the 2 on the left. On the far right, this is now 1 week after he has convinced her to consume plant-based nutrition. Now, the urinary calcium is in that blue band, and it is normal. Now we switch gears to cancer. Now this is from a good friend of mine, Professor T. Colin Campbell from Cornell. And what Colin did in this particular experiment was he established these little cancer clusters with alpha toxin in the liver of these rodents. And then he would give one group no more than 5% protein. And interestingly enough, no new tumors develop. But as soon as he elevates the percentage of protein, you can see that those cancer clusters took off, enlarging their growth. Now, he did the same thing in another way, where he gave this particular protein nutrient, which actually was casein in all these experiments, the major protein in dairy. And you can see when he initially gave this casein that the tumor took off in that first yellow block. Then he stops the casein, withdraws it to 5%, and look, the tumor actually shrinks. Then he reintroduces it again, this time at 20%, and the tumor explodes. Again, he takes it off, and it regresses. In other words, here he is turning the cancer on and off just with the amount of protein that he's using. And this simply is showing the typical human range of tumor with protein. You can see that you're fine as long as you're staying down around 5 or 8%, but when you get up into that human range, this is when the cell clusters begin to take off. Here is actually an interesting slide of Ken Carroll, the late Ken Carroll from Canada, comparing the rate of breast cancer with the amount of fat in the diet. And on the upper far right, you can see that the Netherlands, Denmark, New Zealand, and the USA have the highest rates of cancer. On the low left, you can see that those that have the least are Thailand, Japan, Philippines, and El Salvador. What Colin Campbell did was he drew that orange line to try to show that indeed it also correlated with animal products. Now, everybody wonders with plant-based nutrition, are you going to get sufficient amount of protein? And here, if you look at hamburger, 37%, and spinach, 57%. Popeye had it right. When you're eating plant-based, there's no way you're going to be protein deficient. Now, this is another interesting study of the insulin growth factor and cancer risk. The relative risk, for instance, of prostate cancer, when the IGF blood levels are low, so is the prostate cancer likelihood is low. We look at breast cancer, it's exactly the same thing. Now, one of the ways you keep your IGF low is you avoid dairy products. For instance, insulin growth factor 1 in diet, it's highest in those who are eating meat. Next, it comes lower between vegetarians, and look what happens with the vegans. You have the lowest IGF-1. Very interesting how, as we just think back for a moment, how with both vascular disease and cancer, that nutrition can have a powerful influence. And here you see the IGF-1 with milk and with the control group. Very powerful how dairy products will elevate IGF-1. As more people eat high fiber foods, this is a little look at humor, I'm afraid. The gas blasted into the atmosphere is increasing dramatically. Robert Park of Scotland's Research Institute warning that human flatulence may be contributing to global warming, but the one that really does it a lot more are all the animals, because as we pour and feed these animals, we get tremendous amounts of methane, and the methane accounts for over 51% of global warming. Now, once again, how do you get your protein? This is an example of a man, Joe Relino, Coney Island, 1921, world-famous strongman, amazing feats of strength at about 168 pounds, 5'7", and Joe Relino and his mom were from the old country, and they were totally plant-based. And this happens to be Joe Relino, where he is bending a spike with his teeth. This happens to be Joe Relino at age 103 years. And I always like to show this as the A building at the Cleveland Clinic. And for those of you who have not been to Cleveland, I always like to be sure you know what the trees look like in February. However, after I retired from surgery and I got involved with the Wellness Institute, we found that the budget is a little bit more modest, but the morale is quite high. And I always like to conclude with this photograph. This is a young damsel in 1939 in Life magazine trying to learn how to do the splits. For one thing I've learned in the years I've been away from medical school is that although brains are important, nothing is as important as persistence. And here this damsel is trying to learn how to do the splits, and she stuck with it and stuck with it and stuck with it. Sure enough, the other day in downtown Cleveland, somebody spotted her and she had got it right. Now, if we were to summarize what we've perhaps learned here in these last 4 series, I have nothing but the greatest admiration and respect for my cardiovascular colleagues. But Thomas Edison once said that dissent is essential for progress. And I think that this #1 killer in the Western world really perhaps deserves another good, careful look. Because right now, cardiology as it's practiced cannot cure patients. Cardiology as it's practiced will never end this epidemic. And cardiology as it's practiced is absolutely financially unsustainable, even in the wealthiest country in the world. And I think it's a mistaken belief to suggest that patients with heart disease won't accept this type of lifestyle change. It's not that the message is wrong. It's how the message is articulated. Number 3, I think it may be totally unfair of me to ask our cardiovascular colleagues to shoulder the burden of this lifestyle and nutritional literacy conversion. I think they have busy schedules, they may lack the passion for this, and they don't have any of the nutritional education or the lifestyle modification education that is necessary. Those of us in lifestyle would really welcome the opportunity to work synergistically in the spirit of cooperative endeavor with our cardiovascular colleagues to help their patients to make this transition, to become empowered as the locus of control to halt their disease. And finally, I think it's time for us to really almost rejoice in a sense that we have the tool at our disposal, plant-based nutrition, to halt this common chronic killing disease. And I think it's unconscionable not to mention this option to patients. Thank you.